Hi everyone, this is Steph Shellhammer. I'm answering the Week 12 discussion question, which is pertaining to decision support systems. In this week's question, we are looking at an evaluation study on a decision support system that related to cancer therapy that was approved by experts in only 79% of the cases, and that was the end of the evaluation. So the first question was, do you believe that this performance is adequate for a computational tool that's designed to help physicians make decisions regarding patient care? And my answer to that is yes. I think using the 80-20 rule, if it's good for 80% of cases, then that's what you want to build your product on. So I kind of related it in my head to my own role at work, where I help to build order sets. And kind of our rule of thumb is, when we're designing it, we review the evidence, we review with the experts, physicians within our practice or within our hospital, and then we kind of pull all that together and think what in this order set would be for 80% of the patients. We don't want to build orders in there that would only apply to a small percentage of outliers. So I think in that regard, you go with what the majority is saying. Another example I thought of within my hospital is we have a decision support system that provides reminders for VTE prophylaxis for physicians. So it reminds them, it has options for mechanical prophylaxis and pharmacological prophylaxis, but it's only as good as what the physician can has to think through. So if the patient has a clotting disorder that would prevent them from pharmacological prophylaxis, the physician would have to remember that, and the decision support tool isn't going to think through all the possible scenarios with him. So while the decision support tools, I think, could remind in some cases, they're not going to be perfect, and you're always going to need that bit of clinical knowledge and decision making. So the other question was, would you be willing to visit a particular physician if you knew in advance that she made decisions regarding treatment that were approved by expert colleagues less than 80% of the time? And my answer to that would be yes, for the reasons that I said above, and also just thinking through this example with concerning cancer therapy in particular. Medications are changing so rapidly. There's so many advancements all the time that there's always probably going to be, even within the expert realms, 10% who are above where most of the experts are, and 10% maybe who haven't quite gotten there. So I think there's always going to be that bit of variation, and you want to kind of build your system where the majority are, and where the majority have decided is where practice should go. People who maybe didn't agree, but our expert colleagues may have, their own pet projects going on, or their own research that they haven't published yet, and that's why they're not agreeing. I think that you don't quite know where that research or where those experts are coming from, so I think you have to go with the consensus of the 80%, and I think that will probably direct you most of the time to where the care should be. So I would count on my physician to interpret that, use the decision support, and then be looking at my own personal history to help determine if I fall into what the decision support system is telling her to do for me. Looking forward to your feedback. Hope everybody has a great week. Thanks.